Welcome, and thank you for joining us for the last of our four-part program, Digital Health and Care, Opportunity from Adversity. I'm Keith Friedenberg, Executive Vice President and Chief Operating Officer with Chime, and it's my pleasure to welcome you to our presentation today, The Future of Health and Care. This program is brought to you by Chime, Chime Innovation, and our proud sponsors at LK, and I'd like to also offer a special thanks to Health and the entire Health team for their partnership and support. What can we say, but the world has changed. We are in the midst of radical transformation. And that radical transformation has caused us to stop and ask ourselves some questions. In healthcare, who is the customer? How do we engage them? What new strategies, tools, and skills are required to deliver value in this bold new digital health world? Well, the answers are both simple and sometimes incredibly complex. Early in our program, if you've been with us most of the day, we've evaluated these and other questions from differing perspectives, from consumers and clinicians to policymakers, all of whom are striving to build opportunity from this great adversity we've been facing these past several months. In today's session, we're looking over the horizon and we're going to peek into the future. How can such rapid change be leveraged to improve health and care globally? And how do we unlock the opportunities that have been presented to us of a digital health ecosystem while also protecting patients and providers from some of the inherent risks involved in this transformational change? I'm delighted to introduce an amazing panel of thought leaders who are going to probe these questions and many others. Dr. Andrew Rosenberg, CIO at Michigan Medicine. Mark Probst, CIO at LK. Tanya Townsend, Senior Vice President and CIO at LCMC Health. And Teresa Meadows, Senior Vice President and CIO at Cook Children's Healthcare. Our facilitator for this session today is Jonathan Fritz, Chief Innovation Officer at Chime. And Jonathan will moderate a live Q&A session with both Tanya and Mark immediately following today's presentation. So I hope you can stay with us and participate in the discussion that follows. On behalf of Chime, Chime Innovation, LK, and the entire health team, thank you again for joining us, and we hope you enjoy the presentation.
Hello, and thank you for joining this session offered through Chime at the Health Virtual 2020 conference and allowing me to talk a little bit about the future of health and care. I'm Tanya Townsend. I'm the Senior Vice President and Chief Information Officer for LCMC Health, based out of New Orleans, Louisiana. So I thought I would describe my organization a little bit. We, as of a week ago, we were 5 hospitals and we're actually now 6. Based out of the New Orleans market. We're now approximately 12,000 employees and 2,000 beds, and we range in services starting with our Children's Hospital of New Orleans, which is our founding member, and we focus on children and pediatrics at that facility, all the way to complete academic medical center with University Medical Center and partnering with our partners at the medical schools of LSU and Tulane here in New Orleans, educating the future clinicians in this area. And that is the only level 1 trauma facility in this area as well. So a little bit about our background. You can see we started out again as our founding member was Children's Hospital of New Orleans and partnered with one of our hospitals, Touro Infirmary, to form at that time LCMC Health in 2009. And then we continued to grow and expand and acquire along the way, as recent as last week, adding our 6th hospital, East Jefferson General Hospital, to our fold. A little bit about me. I've been doing healthcare IT specifically my entire career of over 20 years. And so I'm very passionate about it. I'm very excited to share my experience and talk a little bit about what I think the future holds. So in order to really talk about where I think we're going, I wanted to take an opportunity to talk about my experience and where we've been, because I think these were foundational moves and foundational items that we will continue to expand and grow and advance. And I'm very proud to say, again, spending my entire career in healthcare IT, I'm very proud of the progress we've made. When I started, everything was still very much paper-based and paper charts within our healthcare industry. So I thought I'd give a little bit of a walk in history of my experience. This is not necessarily completely in sequence, but a lot of it intertwined, but it really has taken these 20 years to get us this far. So starting with the concept of the electronic health record, that's where I think it all began. And our vision at that point was to become more efficient and to be safe and to provide better quality for our patients. And that remains our number one goal today, but that's where it all began. So my experience specifically, I had early on in my career, I had the opportunity to open at that time what we were marketing as the only all digital hospital in the nation. And the main goal there was to build a hospital from the ground up with all technology and all digital in mind. So we didn't have a medical record filing room. There were no paper charts floating around. And at that time was the beginning stage of even forms, consent forms, et cetera, really being more automated and digital and having the ability to e-sign those types of documents. At that point in time, everything was still very much best of breed, meaning there were solutions and expert applications for individual needs, and we tried to interface those together. And there was the notion of, as an interface really meets the definition of integration, but that's at that point in time, a lot of custom development happened as well. That's what we had for our EHR strategy. Advancing that a little bit, we went into pushing the envelope on wireless in its very early stages. 5G certainly wasn't an option at that point. So we were pushing the wireless envelope to make sure that we could be mobile. We started to explore things like voice recognition, real-time scanning. All of that played into this digital notion of having no paper charts and having real-time information available across the continuum of care. Advancing from there a little bit, the new activity within the industry was a lot of mergers and acquisitions started, and a lot of organizations started to move into the concept of integration and turning more into an operating model of shared services, shared resources, not so much a holding company, but how can we take care of our patients in an integrated fashion? And that's when the push started to happen more around a single solution across the continuum of care, moving away from that best of breed model so that we could share that in an easier way. And of course, that's when meaningful use started to come along, where the government started to realize we need to move this activity along faster. And we had the opportunity to collect incentives by implementing faster if we met the expectations, which of course then turned into penalties. But that definitely helped expedite where we're at, and things like computerized physician order entry and clinician adoption around that, and the concept of evidence-based medicine started to really take fold and receive a little bit more adoption and attention. And then as we continue to advance into the regulatory requirements of being a meaningful user, we started to see more of the integrated electronic health record solutions, moving again away from custom development and best of breed applications. And then again, not all of this is necessarily in sequence, but now we started to become more intelligent on what we wanted to do with these tools as we collect information electronically. So things like best practice alerts and starting to automate predictive analytics so that we can potentially proactively monitor our patients or respond to something before a patient deteriorates. And then lastly, population health started amongst all of this, and the real move from volume to value started. So we needed to use our electronic health record to potentially keep our patients safer in the ambulatory or outpatient setting and avoid some of the more costly acute setting stays. So all of this has been my experience for the most part over the last 20 years. And I'm really excited and proud of how far we've come as an industry, and looking forward to continuing to expedite these things even, or accelerate and advance these things even greater now. Also, I think what we're facing right now, that with the pandemic, really highlighted our technological advancements and how important they were and are to responding to the pandemic, both in a rapid fashion and an analytics fashion. So these were just a few examples of what we did here in my organization. So one of the activities I did here was through those mergers and acquisitions. We, of course, typically, like all of you, if you've gone through that, you inherit a lot of applications, a lot of disparate systems. So we embarked on a journey for 3 years to consolidate and move to an integrated electronic health record and revenue cycle solution. That took about 3 years and got everyone onto the same platform. And one of our hospitals at that point in time was actually still on paper. So what we realized when the pandemic hit was we had the ability to rapidly share information across the entire enterprise, which would have been nearly impossible to do in that prior state. We were able to very quickly add new units, close units, and even went mobile to be able to have testing sites outside of our facilities. I'm sure like many other organizations have experienced, telemedicine exploded and it is here to stay. We had somewhere around 25 visits back in January total for the month across our organization. And by the month of April, we had 25,000 visits with telemedicine. So that is here and here to stay, and enabled, of course, by the technology that we were able to introduce. Lots of data collection, lots of reporting capabilities that allowed us to not just respond, but also understand, share, predict in a very quick manner that, again, would have been very difficult to do in our prior either paper or disparate environment. We started to move towards virtual training. So we didn't have to do the classroom as we're continuing to introduce new employees or new providers. We moved to a completely virtual environment where we had been thinking about that previously, but now we made it happen very quickly. Same thing with people that were able to had to very quickly work from home and move from the facility to being able to take their device or have the capability to log in from home. We were very capable and ready to do that. And we added some infrastructure and security to do that safely. Managing patient access became absolutely a necessity. So we know that patients were either delaying care or no-showing or needing to cancel appointments. So we had the tools and the ability to now analyze that information and proactively reach out to those patients to bring them back in for the care they received once it was safe to do so. Patient portal, just like telemedicine, expedited very quickly. Patients now expect it. They're doing online scheduling. They're communicating with their provider. They're doing telemedicine, they're filling their prescriptions. So that is here to stay as well, and we're excited to see that advancement. And really all of this just means that we can't take, my opinion is we can't take another 20 years to continue to advance this like we had in my last slide. We need to be able to take this new agile culture that we proved that we can do and do more of that as we move forward. We can't take 6 months anymore for one module or one functionality to roll out. We need to be able to continue this pace and momentum. So with that, this is a high level of what I think are some of the opportunities and will be key to the future of the digital future of health and care. And this also is not necessarily in any specific order, but I think our future will continue to highlight the patient and the clinician together being of utmost importance. So some ideas around that: digital employees. I think that is a huge opportunity to continue to automate certain functions, certain very repetitive functions. We saw this, for example, with the migration of transcription. So transcription services where we dictated into a microphone and we had a tape recorder, and that took a while to actually have somebody transcribe and get back into the medical record. That was replaced with voice recognition, which has come such a long way since I first started looking at a while ago. So I think there's more opportunities just like that we're going to continue to explore. Of course, we do still need to manage the cost of healthcare. So everything that we can do to continue automating, reducing length of stay from the acute setting, keeping patients healthy through population health, making our the price for healthcare, much more transparent, which I know we're all working towards for a January timeframe. That's going to continue to be very important. The move to the cloud has come a long way, and I think that will only continue. Things like voice recognition are working great. Not only is the functionality now available and the capabilities much more feasible, but we almost want to or have to do it with all of the security concerns that we have in the cyberspace and even business continuity. So me being here in New Orleans, we are actively monitoring the weather because we've been very fortunate, but have had many hurricane scares just this summer alone. So business continuity will become very important as another reason to move to the cloud. Telemedicine, that will only continue to expand. More and more remote monitoring with vitals integration, integrated specialties, so it might not be just a one-on-one patient to one caregiver. We might have a whole caregiver team participating in that telemedicine visit with the patient. Patient access will continue to expand, very similar to what I just mentioned, is the key to getting our patients in the door. They're going to want to be messaging with their provider, even potentially even have the opportunity to ride share if they do need a vehicle or a ride to the facility. And then I'll kind of combine these other areas together, but prevention is going to be key. We all know about the opioid epidemic. We know it's preventable. Same thing with diabetes and hypertension. How can we use the data in our electronic health record and the population health and data analytics to help prevent these diseases? And how do we look at benchmarking data and use that in a networking fashion across our industry to educate each other on how we continue to improve our health of our population? And lastly, around predictive analytics as well, social determinants of health. How can we understand and predict what a specific patient's social dynamics might be that we can help identify proactively? And same thing with patient deterioration. How can we use the analytics and artificial intelligence capabilities to identify when a patient might be deteriorating so that we can proactively respond to that quickly and even identify what the right level of care is for a patient? And then lastly, around genomics and understanding a patient's potential gene pool and how that might predict or prevent some disease in their future. So those are just some of my ideas. I think all of these could be a session of 15 minutes by themselves, but those are some of my ideas of what the digital future of health and care will be. So thank you for allowing me to share my experience and share my thoughts. I appreciate being here and hope everyone enjoys the conference. Thank you.
Hi, everyone. I'm Teresa Meadows. I'm the Senior Vice President and Chief Information Officer at Cook Children's Healthcare System in Fort Worth, Texas. And it's my pleasure today to talk to you about the future of health and care, but specifically around some of the cyber risk issues that we will experience, that we could experience based on the rapid changes that we're seeing in our market today. As many of you know, I like to dub this the perfect storm meets Jaws. And what you'll see here is many things are really disrupting the provider market, not to mention which is causing a lot of distraction. So if you look at the screen that I have here, you'll see, we have consumer demand, there's technology disruptors, there's rapid changes in our environment that we're having to deal with, and just regulatory uncertainty as we go through not only some new regulatory things in the next couple of months, but also a change in leadership potentially as we go through the next presidential election, which always drives uncertainty and regulatory changes. A perfect storm is really when many disruptors come together in just the right order or fashion. And so you can see here that these things really cause the providers to have uncertainty and get distracted. And so that's a perfect opportunity for Jaws to sneak up, which is our cyber criminals, and really take advantage of us not being totally focused on the big picture of what's going on in healthcare. And some of the rapid ramp ups, many of you participated in over the last few months, but virtual visits alone went up 4% just from 2019 to 2020. And what you'll see is that in 1 month, we pretty much doubled where we were in virtual visits. And so that rapid ramp up really opened the door for potential security issues or cybersecurity breaches because people weren't paying close enough attention. The good news is, 80% of our customers really love virtual visits, and they say they'll continue to do these virtual visits post-COVID, which is something that we've all really wanted to embrace over the last even 10 years of having more telemedicine and virtual visits in our ecosystem of things that we can provide better care with. And the other interesting thing is before COVID, only about 33% of Americans worked remotely. And now post-COVID, over 77% of Americans are working remotely. So this puts another strain on not only how we deliver care and deliver things to our employees, but also ensuring that we have the right security measures in place. What I'm sharing now is a study that was done by the Deloitte Center of Health. And it really talks about the consumer demand. And the first screenshot you'll see is really just the increase of Gen X and baby boomers who are really adopting virtual health. And you can see that just in a couple years, you're seeing those areas really grow with a 7% increase in Gen Xers and about a 5% increase in baby boomers really wanting to adopt virtual health. The other interesting thing is Gen Z. Everyone on Gen Z is using virtual health. And so if we don't start making those transitions, we are going to lose patients. And then what you'll see on the other half is that almost half of the respondents in this study said they would use some sort of home diagnostic equipment to support their care, which is a big shift to where we were even a year ago. So as things are getting rapidly adopted by our patients and consumers, we have to think of new ways to secure those environments and secure our next generation of patients. The other thing was really interesting that this study showed is that, patients and consumers are more willing to share data than they were ever before. And so prior to COVID, people were very cautious about the types of data that they would share publicly. But now you can see post the crisis or post the pandemic, 18% of people will share their data with tech companies. They'll share it with top retailers. They'll even share it with their insurance companies, which has been a shift over the last several years. So now we have more data that is going out of our systems and being shared, and finding ways to secure that data is extremely important. The regulatory uncertainty. As you look over the next few months, the 21st Century Cares Act actually was issued in 2016, but is going to effect in November. And part of that are the rules around information blocking and the ability to share access with patients and technology providers at patient data. And this is a very big shift in how we've traditionally provided data to our patients. Most of the time it has been on request. You can think of this as more of the open notes concept, where we're going to be sharing in near real time most pertinent information with the patient directly. And then with providers or health IT companies, we'll be providing data upon request following the US CDI standard. This has posed some unique security issues and privacy issues that we need to continue to keep our eyes on, and how we want to provide the data to our patients and then the technology providers. The other interesting thing is some of the privacy restrictions have been loosened, which has allowed us to use Facebook or Zoom for patient telemedicine-based visits. And when we do that, we also did not really pay close attention to all the security precautions that we probably needed to put in place to ensure that those visits were secure. And so as we move through these changing times, it's really important not only to rapidly deploy technology, but to also ensure that you're meeting all the regulatory requirements and the security requirements that are associated with these changes. And last but not least, many of us are struggling with budget. due to the COVID pandemic. And we have limited budget. So we're choosing sometimes the path of least resistance to get technology deployed, which then sometimes leads to cracks in our armor as far as cybersecurity is concerned. Technology disruption, man, if you're not paying attention to this, this is something that is just going crazy. So are a few examples that have just happened within, the last 6 to 9 months. And if we don't think that Walmart and Google are going to disrupt our world, I think they are. The picture on the left is a new Walmart health clinic where they're actually in the DFW area starting to see primary care patients on a walk-in basis. There was lots of technology deployed for COVID, whether that was contact tracing or symptom tracking. And you can see the pictures in the middle. That's actually me getting my temperature checked on one of our temperature check scanners. And this was something that was built, in a couple of months by a company and then deployed. And so ensuring that all the security precautions were there is something that we really need to keep an eye on and ensure we're protecting the data for our employees and our patients as we scan them for fevers and other symptoms. AWS and Amazon, they're on the upper right, they're really making a big play into healthcare, and not only in just patient care, but also in the supply chain and distribution. And so they're learning a lot. While we're struggling with keeping up for COVID, they're actually continuing to work on their strategy to move into healthcare. And you can actually see the very first wearable that they produced. You can buy this on Amazon.com. It's called Halo, and it can start tracking some of your vital systems and then reporting that back to any personal health record that is out there. And as we begin to watch telehealth and virtual health visits in healthcare, we know that there's been lots of discussion about funding, and will funding continue as far as from an insurance perspective, so that physicians will get paid for these visits, much the same way they get paid for in-office visits. As we kind of deal with those things, the investment in telehealth is not stopping. And you can see here that we might have a plateau in visits in telehealth, but the funding with venture capitalists or other big companies is not stopping. And you can see we've had companies spend almost $200 million in investment in improving telehealth and virtual health. And all of these things are going on in the background as we're trying to catch up to where the industry is going. Here's another example of just wearables. And as part of the 21st Century Cares Act, we will start getting requests from patients who want to send their medical data to Fitbit, or they want to send their medical data to an Apple Watch or some other application. And we're going to start seeing a lot more remote care into the home. And as you can see, the gentleman here, he's working through some of his respiratory exercises that he would need to do on a regular basis. And the beauty of that is that he can do that at home, and then that data then integrates to the electronic medical record or application of his choice to keep the doctors alert. And the good news about that is right now it prevents him from having to come in for a doctor's visit. But how are we securing that? And how are we ensuring that his home is secure and that the data that he's sharing is not being exfiltrated to others unnecessarily? And I think these are all questions that we're starting to ask ourselves about how do we begin to put good risk assessments and risk precautions in place to ensure that we can deploy these remote technologies, because they really can help produce better outcomes, but also protect the patient and protect our organizations. And I thought I would just end it with some good news, or not so good news. Unfortunately, with the COVID pandemic, cyber criminals saw this as an opportunity to begin attacking us. So as you can see in the very top, one of the very first COVID-19 tracing apps actually was a malware posing application that actually took your data and used it for bad and not for good. And so, if we cannot depend on our health data, our nation's at risk. And so as we go through the pandemic and looking at all these disruptions, we've got to ensure that we're protecting the data. And I'm going to show you some data in just a second, but the World Health Organization saw a five-fold increase in cyber attacks just from the beginning of the COVID pandemic in the United States, which was about March timeframe. And between the months of February and May of this year, we had 132 reported breaches. This is 50% more than what we saw this time last year. So the criminals are definitely taking advantage of the fact that we're distracted with lots of things going on in our environments. And some sad news, one of the things that I've talked about many times is that cybersecurity is a patient care issue. And for the first time, we can actually link a death of a patient to a cybersecurity attack. Many of you probably read this in the news. This is a German hospital who was a victim of ransomware. The intent was to actually attack the university that this hospital is attached to, but actually ended up getting the hospital as well. And so the patient was diverted because the systems were down, and in the diversion to the other facility, the patient died. And so cybersecurity is definitely a patient issue, patient care issue, and it's something that we need to keep a close eye on. Couple more statistics. Between the month of March and April, this study shows that there were 300,000 new COVID sites developed, all of which had some malware produced. So if you were searching for information about COVID, you could potentially have ransomware downloaded to your devices. And then last but not least, this study was done by the World Health Organization and Barracuda, who is a cybersecurity company. And they show a direct correlation in the number of cybersecurity, ransomware, phishing attacks, and the number of COVID cases in a year. And you can see that there's a direct correlation to the increase in COVID and the sicker that people got, and the more it spread, to the number of cybersecurity attacks that occurred throughout the pandemic. And so I would end with saying, I think it's really important. The digital frontier is here, and we need to embrace digital, but we also need to ensure that we put the right risk mitigation plans in place and ensure that we have the right technology and support to keep our organizations and our patients safe. Thank you for your time today.
Hello, everyone. Welcome to Chime and Virtual Health. My name is Andrew Rosenberg. I'm the CIO at Michigan Medicine. I wanted to briefly talk about some items that occurred in our COVID ICUs, but really from the perspective of a CIO, of a health and IT leader, some of the aspects that we dealt with that I think are going to be important for the future. I've been a CIO now for about 5 years, and prior to that, I was CMIO for 6 years. But I got into all of this as a critical care anesthesiologist. And so when we were at the peak of our COVID crisis in the Detroit, Ann Arbor, Southeast Michigan area, I jumped back into critical care for about 3 months, helping out in our COVID ICU. And from certainly the human and physician point of view, it was relatively similar to the kind of critical care I dealt with before. There were some exceptions, of course, but what I want to focus on were some of the observations and some of the interactions I had that, to me, gave me ideas as a CIO and a healthcare leader that I thought you might also want to hear about. To set the stage, I just wanted to give you a bit of an impression of what we were going through, and some of the images here were actually captured when one of the local newspapers did a story on us, and some of these pictures were from that story. In front of you, what you can see is one of the first major problems we all have dealt with across the country, around the globe, are problems with communication. You can see pictures of nurses using walkie-talkies, sometimes walkie-talkies we even brought in from home. You can see pictures of nurses writing information on the glass so that people can see information, because we had trouble, as you can see in the bottom left, talking to each other. We had to talk through glass, we had to talk through face mask, we had to try to use a variety of tools. We used our own phones, we used phones that we were given, or phones that as the CIO I made immediately available that were never meant to be used at this time. And so this issue with communication was one of our most challenging. But perhaps even more touching were the challenges of families being able to talk to their loved ones, patients who were actually awake and alert but in the ICU, or more importantly, patients who were really sick but their families couldn't even see them. And we would write notes and we'd try to communicate. Perhaps the most difficult thing I had to deal with, and unlike anything I've done in 25 years of critical care, was withdrawing care from patients who are dying over the phone. And this is a picture of me and Preet Sokar, one of our nurses, where we are talking to family members who we had never met, who we couldn't see, who could not come into the room, who could not be part of the process that we would typically do because we didn't have the communication tools. And so we were using some of our phones we bought to start unified communications, and we just rushed them right into operations. And in the end, here's a picture of Preet actually with FaceTime, helping her family say goodbye. So we used Zoom, we used FaceTime, we used Skype, we used whatever we could. And so those are, of course, very deeply moving moments. And from a human point of view, from a clinical and healthcare point of view, in and of itself, those are remarkable and indelibly imprinted on my mind. But at the same time as the CIO, I also was watching this in a very different way than I had before when I was just a director of critical care. More recently, I've now joined the VA to do my the little bit of critical care, clinical care that I do. I do it now through the VA tele-ICU program. And while tele-ICU and telehealth, of course, has just boomed, and many of you are familiar in seeing elements of it, there was another aspect that I found particularly important where what you can see is on the left with this arrow, that's a typical video into a patient's room. That makes a lot of sense. That's telehealth. But what also is equally important in this work is video and other real-time collaborations with our other clinical partners. In this case, we're using Microsoft Teams in order to communicate with the central nurses or other people around work that we have to do with each other that might be separate from an individual patient care. We can notify each other of issues that are going on and things like that. And so real-time telecommunications is equally important as the types of telehealth and communications you might normally think of when you think of telehealth. In talking to the CEO of a pretty large company, he said it perfectly when I asked him about how things like unified communications are going. He said, those places that have it in place, they're reaping the benefits. And right now, those who are not are wishing they did. And we were one of the latter. We have a plan. This diagram is one that I've used many times as the CIO to generate discussion, to figure out timing, priorities, funding, things like that. And fundamentally, the idea around unified communications is to take one device and replace many, replace our pagers, replace our desktop phones, replace barcode scanners, walkie-talkies, portable VoIP phones, and even some of our computers with one device, combining applications and their linkage to patients, to providers, and things like that. The earlier picture I showed you was me and us using the phones that we bought for this project. The problem is we hadn't had time to implement our full version of unified communications. Since then, we have now started to move this at a much faster rate, and some of my colleagues around the country has made this move very, very quickly. And of course, those who did it even before the crisis, they have found the invaluable time and effort it takes to have these kinds of real-time communications. So there's no doubt that one of the things that we all will see going forward is a rapid acceleration to these forms of combined communication tools, applications, and then we need to think about the infrastructure to support it. What does it take to buy thousands of phones and to replace them every 3 or 4 years? How do we use a corporate or a business level tool with things that people also want to use for their personal life? By the way, we did that with pagers too. We did that with desktop phones. We did that with BYOD computers. But now we're going to have to do it at an increasingly large scale. Then we also have to combine new functionality like alarming and other tools into these mobile devices. This is an excellent example of how mobile has been accelerated through communications by the COVID crisis as well. One other thing that we did was this. we have about 150 radiologists, all of whom now were really supposed to work from home. How do you do that? Well, we set up a very minimal, viable product that you can see here of a remote workstation that we could rapidly deploy to radiologists' homes so that they can continue to do the work 24/7 and not skip a beat. Now, one of the things that's interesting about this is not only was it relatively quick to be able to do this, in fact, we went back and forth, you can see here in the picture of a laptop. Actually, this workstation is run with a desktop with an i7 CPU because we needed a separate video card and a little bit of a higher level CPU to do the kind of rendering, video rendering that we needed to, or image rendering that we needed to. But the reality is this setup here costs about $2,000. Now compare that to what we typically do, where we run large workstations that cost upwards of $22,000. This is an example of one of those kinds of in-hospital workstations where all of those radiologists used to work. And now many of them are working on some more of those remote setups like I just showed you. The point is not lost on me that the COVID crisis immediately accelerated something that works. And it works at 1/10 of the cost. And I just list this here to show the costs of that on-site setup that we have. It's about $22,000. And then what a remote setup would look like, including multiple screens that could do the job. Now, it doesn't do the job as fully as a hospital-based workstation does. I get that. But it more than did the job for what we needed during COVID and now afterwards. As this somewhat busy slide shows, what you can see are the number of daily studies being reported using remote workstations from May until the end of June. And what you can see is that there is very clearly days where we're achieving 300, and then as it became more prevalent, 400, and then 600 studies being reported out per day through these remote workstations. Is that going to replace all of our needs? Of course not. But we have to be prepared for this to become more of the standard. Just as we're working from home and perhaps watching this video from home, more and more of our remote imaging work is going to happen from home. We're going to have to think about the costs, the infrastructure, the telecommunication, the networking, the cybersecurity, the device replacement, the capability, as well as some of the other setups. And these are new things that we all have to think about. Now, we also can be creative about it. We can also see where we can decrease costs in order to do this kind of work. So why do I bring up imaging? Well, I brought that up because it was related to work that we did in the COVID unit. And I think it is a good demonstration of work that others are doing around more and more remote radiology and work like that. But I want to transition briefly into another story to point out where I really think the challenges for doing much more of the support for the infrastructure that we have to be thinking about. And here's the story that I want to tell you. On the left is an example of how much data we at Michigan Medicine, the University of Michigan Health System and Medical School, produce a year with our EPIC EHR. We produce, depending on how you want to count it, 5 to 10 terabytes of data a year. Notice I said a year. Now on the right, we have done an audit of research-based imaging tools. These are very high definition microscopes, such as light sheet microscopes, very, very sophisticated additional types of microscopes for molecular observations, as well as some genome sequencers. In just looking at a very brief list of 17 devices that are actively running at the University of Michigan, these devices have the ease of producing almost 300 terabytes of data a day. Now, that doesn't mean we produce that every day. It doesn't mean we store it every day. It doesn't mean we hold on to that data every day. But it does mean that these tools are not just theoretical. They exist in our environment. They exist in other research-oriented health systems environments. And they produce data that absolutely dwarfs anything that we're used to doing, even with something as big as our EHRs. So why do I bring that up? Why is that relevant? Well, again, as both a clinician and a CIO, I've been thinking a lot about this over the last few years, but COVID has been the catalyst to think about it in a much more comprehensive manner. We don't just have radiology that is amenable to viewing at home. We have the ability to start now digitizing pathology. Some places are doing it. We are starting to do digital pathology as well. In fact, part of our PACS vendor-neutral archive strategy is to have a common store for images, regardless of whether they're radiology or pathology or cardiology or dermatology or ophthalmology or intraoperatively. We are going to have a lot of digitized data in the form of imaging and sensors that we're going to have to collect, process, analyze, store, archive, transmit. And an example that we're already seeing that I showed you before in the research space is going to be what we're going to see more and more in the clinical space, in the operational space. And just as we had to move from on-site, very expensive reading systems, and we moved much of that remotely, my suspicion is we're still going to have a large demand, whether it's the individuals, whether it's work-life balance, whether it's talent recruitment, whether it's expertise. We're going to still see in much the case, as we've seen the rapid growth of clinical visits with telehealth, we are not only going to see remote imaging, but from an IT standpoint, how are we going to store all that data like I showed you before? We don't have the ability to do that right now. We're going to have to innovate. We're going to have to think differently. And if you think that's a lot of data, wait till we really get into edge computing and IoT, where we get sensors adding to this imaging data, where we get much more unstructured data and data that are related to healthcare, but not directly in our EHR and in our tools. When we think about much more molecular data, combining it, analyzing it, using video in real time, ambient sound. When we start collecting data from movement, from other devices that are not necessarily healthcare, this rapid rise of data is stuff that we know we're going to have to use. We have examples that we already needed to do it. We saw when we don't have the ability to do real-time communications, video, being able to use other experts who don't necessarily have to be in the rooms to do this kind of work. We will need to have tools to support this. To me, one of the ironies is that the greatest rate limiting step are not our vision, not our desires, not in fact even where we're starting to do this. It might be something as simple as storage, as transmission, as archiving, as where we put this data and how we make it available. How long do we keep it? And so the goal of this brief talk was to point out some of the things that we're dealing with in COVID during this crisis, some things that we dealt with before clinically, some things that we're dealing with right now in terms of remote work, and where we know we're going as CIOs, IT leaders, healthcare leaders. When we think about the virtualization of healthcare, there's absolutely no question that not only do we have wonderful visions and things that we want to do, there's some very basic, good old-fashioned IT infrastructure, technology blocking and tackling, if you will, that we're also going to have to solve at the same time to make all this happen. Well, hopefully that stimulated some interesting ideas, and we'll have some wonderful conversations about it in the next several days in the future, and I look forward to being able to talk and meet with many of you down the road. Thank you very much.
Hi, I'm Mark Probst. In July of this year, I retired as the Chief Information Officer at Intermountain Healthcare, a position I loved and an organization I loved. In August, I began as the Chief Information Officer of LK. And what an honor it is to be part of LK. I was one of their customers and was intrigued by the organization and the things that they do. I'm intrigued by the fact that LK is so innovative across all the different segments of healthcare, just about every segment of healthcare. I'm intrigued by the fact, and I love the fact that they're so focused on data. For those of you who know me, I have a passion around data, data standards, and the things that we're doing in healthcare. And of course, I fell in love with the leadership team at LK. So it's an honor for me to work for them, and it's an honor for me to present to you today some of my thoughts around the future of health and the future of care. I've been involved in healthcare IT for over 40 years. I remember getting on airplanes back in the old first consulting days when I first began in healthcare. And someone would ask me what I did, and I'd say, oh, I do healthcare technology. And they would look at me like I have three eyes. Now today, or at least pre-COVID today, when you get on an airplane and someone asks the same question and I tell them I do healthcare and technology, well, about 3/4 of the airplane is doing that. That shows you the importance that technology is having in healthcare and how our industry is maturing and becoming so much more dependent upon technology and the things that we do. You know, the future of healthcare is pretty uncertain. However, one thing I think we can be absolutely certain about is that technology will continue to play an important role. And in fact, technology will increase in its importance, and it will become a key to achieving some of the goals that we have in healthcare, which include lowering costs, but also in providing care more ubiquitously across our country and frankly, around our world. My vision has been, whether I'm talking about standards or I'm talking about technology, my vision has been that we can close the huge gaps that exist between zip codes in the United States, but between countries around the world where access to care or the quality of care are not at the same levels, and we can level that playing field. But that's going to be done, I believe, and hopefully through this conversation, you'll see through technology and our use of that technology. My goal is global parity. Healthcare is intensely personal. We have rules such as HIPAA that keep privacy and things personal. I mean, it's a law within what we do. But I think beyond those protections, healthcare is becoming increasingly personal. It's not just a personal matter about what care we get. Most of that's personal, unless of course you love Facebook and Twitter and you decide to put your care out there. But by and large, the things that happen to us in the system, we keep personal. But what I mean about it being personal and it getting more personal is our responsibility around healthcare. And I hope you will see through this presentation a continuing theme about accountability and responsibility. Now we're going to see really interesting technologies that support what we're doing around our own accountability and responsibility, but it's going to become an increasingly personal matter. In 2012, my daughter Heather was 11 years old, and I was called to go to Primary Children's Hospital. We knew she was ill, but we were told the diagnosis of leukemia. I didn't know much about leukemia at all. I didn't know much about cancer at all. It's not something that has struck our family. I have 5 children. She was our 4th, and we just hadn't dealt with it. But as we got involved with it, we found just how much data was required, how much we needed to understand, and how we could be part of managing her care. Now, it wasn't our responsibility or our accountability to manage her care. But because we did get so involved and were able to get so involved, I believe she received better care for what she was doing. I believe that as we look toward the future, we will be responsible to manage that care. So not just something we did because we like to, but it's going to be something we need to do. In this presentation, I will briefly go through the 4 bullets. I'd like to talk about how we're going to be armed with new capabilities and new access to technology and data that we've never had. I want to talk about automation and technical intelligence, how it's going to become increasingly sophisticated. Already is, but what's happening today is just the beginning of what we will be able to see. As I've said, the system will expect individual responsibility and accountability, not just for ourselves, mostly, but also for families, for children, for our adult parents that are aging and the things that they need. And then I'd just like to end that I think for at least a while, all the things that we're learning through this COVID experience, we're learning things that I think could last and could have a difference on care and how care is provided moving forward. I believe we will have virtual access to clinical expertise, wherever that expertise might exist, from wherever we are, and at whatever time we need it, and it will be near instantaneous. That's the future of healthcare. At Intermountain Healthcare, we started a virtual hospital, and I'm sorry I use we, I was there 17 years, but Intermountain Healthcare began a virtual hospital. This was really to facilitate B2B within the health system, knowledge sharing and expertise. Utah is a huge state with lots of rural areas. And many of the smaller cities, many of the smaller places that were hours from our urban centers didn't have access to the same kind of care. The virtual hospitals allowed that. So many of you are dealing with the same thing and are involved in the same thing. We also began a B2C capability. COVID put that on steroids. We all now have telehealth where people can access our clinicians, can access clinical expertise very rapidly. I believe these capabilities will only continue to be enhanced and grow. Right now, I feel like our virtual, our telehealth capabilities are more an automation of existing processes. What we will see in the future are new processes created by the fact that we have these virtual capabilities. And these will be faster, these will be better, these will have greater impact on the people that we serve. In 2001, A Space Odyssey, the HAL was introduced to us and seemed like amazing technology at the time. Now, many of you weren't even around, but had tremendous capabilities. That got dwarfed when we started to see Iron Man and Jarvis. And then as we followed the life of Iron Man, we learned about Vision, or actually a humanoid that had computer capabilities that exceeded what any person can do. I believe that much of what we do today, not urgent, not trauma, but much of what we do today are going to be aided by computers. We will be interacting with what I term as Dr. Google. I don't think that's necessarily the technology that will do it, but I think we're all familiar with what I'm talking about. And we're going to get care in so many broader areas. So the broader definition of going to the doctor is going to mean, well, maybe I went to the pharmacy, or maybe I went to the clinic that's within my facility or my work, or maybe I went to the grocery store. But care won't necessarily have to be done in our hospitals and in our clinics. I believe continuous monitoring with focused coaching. Focused coaching is going to become increasingly important. A doctor can only spend moments with any patient, but through coaching, we can create very sticky relationships using technology, call centers, virtual capabilities, texting, and we can create these relationships that will be far stickier and I believe far more impactful as we try to each of us manage our own health and manage the health of our families. This will have huge value. And then just expound upon what it could do psychologically and do around things like suicide and what could happen in suicide. When Heather was sick, she was sick for 6 years. 50% of that time over those 6 years, either my wife or I were at the hospital with our daughter. That left the rest of us at home. Now, frankly, my wife was at the hospital most of the time, and that left my younger daughter, Megan, to be raised by her dad. I don't know who got the worst end of the deal, but I don't think in the future, knowing what we were doing for Heather, that would anymore or in the future will need to be done within a facility. That could be done at home. And the advantages of that from a cost perspective are obvious. But the advantages of that to the family, to our life as a family, are they're incalculable, frankly, and a huge opportunity that the future provides for us. I don't love the term artificial intelligence because I believe any intelligence is real intelligence, but our systems are going to become increasingly smart. Technology can learn, we've seen that. What it needs is data, and it needs knowledgeable people to provide the algorithms and the capabilities and the data for those systems to learn. Data processing speeds are only going to be limited by how quickly they can access data, and that drives into standards and specialized services, much like what LK does in connecting systems and creating near data ubiquity. As we get that, knowledge will become a commodity that is very easily and quickly shared again, not just between people or not just between hospitals, but across the world. And someone in Africa or someone in India that has a great idea around how to provide care can be shared with us here in Salt Lake City or to the Mayo Clinic and vice versa. Connectivity is going to become seamless, whether we text, video, voice, whatever, it's going to become seamless, and we're going to be able to quickly move between those modalities. And that will just make it easier. And as communication becomes better, I believe the way we care for ourselves and healthcare will become better. And a real-time dashboard of how our bodies function, that's a reality. That's happening. Within 5 years, I absolutely believe we will be monitoring hundreds of things in wearables on our bodies that are going to tell us real insight to what's going on in our bodies and will allow us to care for ourselves better. I love the quote by Eleanor Roosevelt, but I really love the concept of individual responsibility and accountability. We eat too much. We drink too much. People smoke. People aren't exercising. We've been endowed with a blessing called free agency. How we use that free agency, how we use these tools that we've talked about in our lives is up to us. Whether we take the advice we're getting, whether that's technical advice or whether that's from an individual clinician, a human, if we don't apply that, if we don't take responsibility and accountability, we aren't doing our part to lower the costs of care, to improve care for people that we shouldn't have to be in the system. We are taking care from others every time that we are. It's good when we need it, but our responsibility ought to be that we're going to take accountability, use this data that we have, use these capabilities to improve the care that we have. And then this quote as well. I think we're learning a lot. COVID's taught us how to wear masks, COVID's taught us how to social distance. COVID has taught us how, when we need to lock down. I was talking to someone today about Taiwan. They literally don't have a problem with COVID because they've understood what viruses can do and they already have practices in place to manage it. I think our future is going to look more like Taiwan than it did 2019. And finally, from the blessed words of Lao Tzu, those who have knowledge don't predict, and those who predict don't have knowledge. You can take what I said today with a grain of salt. I do base it on a lot of experience that I've had in the industry and things that I've seen. Will what I said absolutely happen? No, but I do think it's likely the trends that are happening will continue to happen. And I do believe, I see a very rosy outlook for healthcare and our role as technologists in healthcare. So thank you very much for your time.